UBMD Orthopedics and Sports Medicine has partnered with Carestream Health, performing both basic science and clinical studies. One of the first and perhaps most exciting clinical studies has to do with patellofemoral instability. Those of us that practice orthopedics and sports medicine, we deal with patients very frequently who have patellar instability. It's been a challenging diagnostic and treatment dilemma over probably 2 decades or so. Recently, with advanced imaging, several objective measures have been proposed to allow us to very precisely and accurately correct patellofemoral instability. But these have been called into question because of their non-functional procedural nature. So take, for instance, a conventional CAT scan, which is done with the patient lying supine, non-weight-bearing, and with their muscles completely inactive. There have been some studies that simulate weight-bearing in a conventional CAT scanner by applying a fairly complicated and wieldy rig within the CAT scanner. And those studies have shown a difference between the measures, between non-loaded and loaded conditions. With the novel capabilities of the new cone beam CT scanner, we can put our patients on their extremity in a more functional position. So they can be fully weight-bearing, we can have the knee in degrees of flexion if necessary, and we can have their muscles active. All 3 conditions simultaneous to acquiring images in the cone beam CT scanner. So we have begun a clinical study, which we are about halfway through enrollment, and I can give you the preliminary data that shows that the indices for patellofemoral alignment are approximately 40 to 50% less when we have the patient in the so-called functional position. So that knowledge should allow us to more accurately correct these patients. And one of the most common and best known postoperative complications is over-constraining the patella or over-correcting the patella. So we should be able to provide a better surgical service to our patients simply based on the outcome of this fairly simple clinical study. So a perfect example of the efficiency of being able to provide cone beam CT in an in-office outpatient setting is a recent clinical vignette that I encountered literally 2 days ago. I had a very young basketball player who fell awkwardly on the court and sustained a tibial plateau fracture. Plain x-rays were very non-impressive. One could see a fracture of the tibial plateau, but it was very difficult to determine whether that was displaced or not. And I was uncertain as whether to advise non-operative care or operative care. It turns out I had to refer that patient to the hospital to get a conventional CAT scan and wasn't able to complete the consultation that day. So there was a delay in getting the images for a couple days, and finally the CAT scan did show a displaced fracture that, in my opinion, required operative care. So it resulted in a delay of a few days in making the diagnosis and ultimately in providing surgical service to that patient. So the portable cone beam CT scanner would have allowed me to get images literally within minutes of the consultation and come up with my treatment plan several days earlier than happened in reality. We've learned over time through our 2 major clinical sites that offering ancillary service to our patients is both good clinical care and cost efficient. It's appreciated by our patients, number 1, and it's appreciated by our payers, number 2. So having learned the value of providing MRI services in the office, we envision providing cone beam CT services to our patients in a similar way so that we can have 1 clinical visit, 1 consultation that is completed at the end by illustrating and educating our patients in their condition based on cone beam CT images. And we think that that will be the future of outpatient orthopedics.